I do want to say, I think that we actually have made some progress in the last 25, 30 years with respect to mental health. Maybe I'm dating myself a little bit, but I graduated college in 1994, and I went immediately on active duty in the U.S. Army as a military intelligence officer. And no, I'm not joking about that. When my spouse and I were having marital trouble, and like any other normal couple, would consider marriage therapy. But at the time, in 1996, that was definitely not okay to do, particularly as an Army officer with a high security clearance. I can honestly look back now and say that I was so indoctrinated into duty, honor, country first at that time that I actually chose not to go to therapy so that I could make sure that I kept my clearance, kept my commission, and made sure that when I was ready to leave, I would have an honorable discharge and I wouldn't be kicked out against my will out on the street not knowing what the hell to do. That kind of a choice really isn't a choice. It sucked, and I'm sad and disappointed about that. I don't think that's the case now in the military. It seems like it's starting to be okay to get treatment, to get help, and there's more and more veterans that are getting help. However, I am deeply concerned about the culture within first responders, firefighters especially, EMS, HEMS, disaster responders. I imagine police also, although that's not my specialty at all. If people are so afraid that they're going to lose their job, lose their access to healthcare, and essentially not know what to do with themselves, lose their identity even, can be more daunting than even the money, then they're not going to seek out care. I don't have all the answers, but I know you all have some, and you have perspective. And just us talking about this, sharing, inviting other people into these conversations, I think that's all we can do right now. Could you do that? Could you start a conversation with a colleague? Ask them how they are. Ask them how their mental health is. My name is Heather Shannon. I run the Adventure Nurse, and I am on a mission to increase awareness about mental health considerations for first responders and healthcare providers. You know very well that first responders and healthcare providers are killing themselves trying to save other people's lives. It's not a sustainable path for anyone. It's time that we consider sabbaticals, paid supported time off, where you keep your job, you keep your seniority, and you're paid not to work for 3 to 6 months, and have some sort of support, some sort of structure, some sort of way to ensure that you have time to revitalize and replenish and feel like you can actually heal. Sabbaticals have been used in academia for years. It's time that we have them in our industry. It's time to make sabbaticals be a cultural norm, a standard thing, just like 2 weeks of PTO every year, education benefits, health insurance, etc., factored into our collective bargaining agreements. Heck, maybe even lobbyists getting reimbursements tied to having the employees treated, more proactively rather than denying our reactive claims 15 years later from workers' comp because you don't see the correlation between the cumulative effects of the stress and trauma of our job impacting our everyday life. Please, if you like this content, if you have a friend, family member, or you are yourself a first responder or a healthcare provider, please follow this page. Like, comment, share, save it, and just keep asking your buddies how they're doing. Thank you.